Thank you for coming to Aetna's Medicare Advantage meeting. Today, you'll learn about the Medicare program and how to enroll in a Medicare Advantage plan. It's called Medicare Advantage for a reason. Today, you'll see what the advantages are for you. We'll cover these important topics to help you understand more about Original Medicare, Medicare Advantage, and Medicare Part D so that you can make an informed decision. After the video, we'll be happy to take your questions. Today, you'll hear about plans offered by Aetna. If you enroll, your coverage in 2015 will be through Aetna. You should have received an enrollment pack when you arrived. If not, ask for one from the representative. Your enrollment pack has an application, the overall CMS star ratings, a summary of benefits, and the multi-language insert. The insert is for those needing help in other languages. How do you qualify for a Medicare Advantage plan? First, you're required to have both Medicare Parts A and B. You must continue to pay your Medicare Part B premium. Second, you have to live in the planned service area. You cannot have end-stage renal disease, also known as ESRD. There may be some cases where this doesn't apply. You should check with your plan if you have questions. Don't forget, if you have health coverage through an employer or union, you might lose your coverage if you join. Talk to your benefits administrator about their rules before you join a Medicare Advantage plan. Let's start with some Medicare basics and the A, B, C, and D's of Medicare. Medicare is for Americans age 65 and older, or under 65 and disabled, receiving Social Security disability benefits for 24 months. What's known as Original Medicare includes Part A and Part B. It normally covers about 80% of your approved medical costs. You're responsible for paying the remaining amounts, including any deductibles. Part A covers some hospital, skilled nursing facility, home health, and hospice care. You typically pay no premium for Part A. Part B covers some doctors and medical services, durable medical equipment, hospital outpatient services, laboratory tests, x-rays, and mental health services. You pay a premium for Part B, which might be paid out of your Social Security check. That premium can change each year based on your income. Part C is Medicare Advantage. Medicare Advantage is provided by private insurance companies like Aetna. With a Medicare Advantage plan, you're still enrolled in Medicare, but your Part A hospital and Part B medical coverage is from Aetna, not Original Medicare. With Medicare Advantage, you keep paying your Part B premium, and you pay the plan's monthly premium if there is one. Medicare Advantage is not a Medicare supplement plan. In fact, you don't need a Medigap policy if you join. We'll take a closer look at Aetna's Medicare Advantage plans in just a moment. Medicare Part D is prescription drug coverage. Part D is also provided through private insurance companies like Aetna. Part D can be purchased on its own or as part of a Medicare Advantage plan. Aetna combines your Part A and Part B coverage into one plan and covers everything Original Medicare covers. It also includes prescription drug coverage when you select a plan that includes Part D. Remember, with an Aetna plan, you're still in Medicare. It's just a different way of getting your Medicare benefits. Aetna plans are like an HMO or PPO plan you may have had before. If you enroll, you'll still be in Medicare and get all the benefits of Original Medicare. But Aetna, not Medicare, will pay for your health care services while you're enrolled in our plan. Medicare Advantage plans are sometimes called Part C or MA plans. They're offered by private insurance companies approved by Medicare. You can enroll in Medicare Advantage only at specific times of the year. The main enrollment time is called AEP, which stands for the Annual Enrollment Period. This is when you may enroll or disenroll from a Medicare plan. AEP runs from October 15th to December 7th each year for coverage that begins January 1st of the following year. There is also a special enrollment period when you may be able to join, switch, or drop a Medicare plan. For example, if you move out of your plan's service area, if you have Medicaid, or if you qualify for extra help. Refer to your enrollment pack for special enrollment qualifications. It's possible you may enroll in a Medicare Advantage plan and then decide you want to drop it. If so, you may do that from January 1st to February 14th, and you'll be returned to Original Medicare. You'll also be able to sign up for Part D coverage separately. This is called the Medicare Advantage disenrollment period. You cannot join or switch to another Medicare Advantage plan during this period. Medicare Part D does have a late enrollment penalty. The late enrollment penalty is a fee that's added to your Part D premium. It applies when you don't have a drug plan that meets standards for Medicare drug coverage. You can learn more about this at Medicare.gov or by calling 1-800-MEDICARE. One thing to note is that if you qualify for a low-income subsidy, also known as extra help, you don't pay a late enrollment penalty. When you enroll in a Medicare plan, they will let you know if you owe a late enrollment penalty. If you don't agree with the penalty, you may get a reconsideration request form from your plan to send to the government. If you need help with your Medicare costs, you can get extra help. This is the name of the Medicare program that helps pay some Medicare prescription drug costs, such as monthly plan premium, yearly deductible, co-insurance, co-payments. Many people with Medicare are surprised to find out they qualify for extra help. You can find out more by contacting Medicare, Social Security, or your state Medicaid office. Or from the Medicare.gov website, you can download Medicare and You. This Medicare handbook is a good place to find additional information on these programs. You could also get a copy of Medicare and You from your local Social Security office. More help is available to find benefits you may be missing out on. Aetna has partnered with the National Council on Aging to sponsor Benefits Checkup. This one-stop resource lets you see if you qualify for programs that can save you money on prescription drugs, utilities, taxes, meals, and more. Go to www.benefitscheckup.org. Answer several questions and get information on over 2,000 federal, state, and private benefit programs. You'll get a personalized report that shows what you may be able to qualify for and what you'll need to do. Now let's talk more about Part D, Medicare's prescription drug program. Your Part D coverage has 4 basic phases: the deductible phase, the initial coverage period, the coverage gap, and catastrophic coverage. Some Medicare Advantage plans have no yearly deductible, so your plan Part D coverage starts right away. During the initial coverage period, you pay your plan copay or coinsurance, and your plan pays what remains until the combined costs reach a yearly specified amount. For 2015, that amount is $2,960. Once your total yearly drug cost reaches that amount, you move into the coverage gap phase. This is commonly known as the donut hole. While you're in the coverage gap, you'll pay 45% of the brand drug cost and 65% of the generic drug cost. Check the benefits of your Part D coverage, as some plans may offer additional coverage while you're in the gap. After your total yearly drug cost reaches your true out-of-pocket limit, you begin catastrophic coverage. This is the final phase. For 2015, the true out-of-pocket limit is $4,700. In this phase, you pay a small copay for generics or brand drugs, or a 5% coinsurance, whichever is more. With Part D coverage, the total cost of a prescription drug is split between you and your drug plan. You pay the copay, which is a specified dollar amount, or the coinsurance, which is a percentage of the cost of the drug. Your plan pays the remaining amount. The total drug costs, both your cost plus what your plan pays, count towards the initial coverage limit. Once you pass the initial coverage period and enter the coverage gap, you receive discounts from the drug company. The discounts are available on both generic and brand name drugs. These discounts will continue to increase each year until 2020. At that point, the coverage gap phase will be completely closed. Every Part D plan has a formulary and a network. A formulary is a list of all the drugs that the plan covers. The formulary is divided into cost tiers that separate drugs into different categories. Each drug belongs to a tier, which determines how much you will pay for that drug. The plan's network includes the pharmacies and mail order options you have for getting your medications. What if your prescription is not listed on the plan formulary? In that case, you can ask the plan to make an exception to cover your drug. After joining our plan, you might find you need a drug we don't cover. You might be able to get a one-time refill as part of a transition process. Your plan may also have additional drug coverage rules, like these. Prior authorization. This is when you and/or your prescriber are required to get approval before filling certain prescriptions. Your prescribers may need to show that the drug is medically necessary for us to cover it. Quantity limits. This is when there are limits on how much you can get at a time. Step therapy. This means we may require you to try one or more similar lower-cost drugs before the plan will cover the prescribed drug. Thank you for your time today. Your on-site agent will now explain more about your local Aetna Medicare Advantage plans. That's what our agents are best at, providing helpful and important information so you can make the decision that's right for you. And if you have any questions about what we've just reviewed, please ask.